Stanford Medical School nearly broke me on day one. But these 8 study techniques got me into the top 0.1% on the USMLEs and helped me match at Harvard. So my first day of medical school at Stanford, I had this really deep regret about coming to medical school. Before coming to medical school, I had taken actually 2 years off. I had been accepted during my final year of college into medical school, but I had deferred. And I ended up deferring for 2 years. I did a Fulbright grant abroad in South Korea where I taught English for a couple of years. So I had been doing something that not only wasn't really science related, but in addition to that, it wasn't really academic related. Like, yes, I was teaching, but it was to middle school and high school students in conversational English. I hadn't done a lot of shadowing at all. I didn't have a lot of experience. I went to a small liberal arts school for undergrad, and so I didn't have a lot of background in terms of biology classes. I didn't know anything about anatomy or a lot of the subjects that we were learning. Like, I had literally been a chemistry major. That was it. And so I remember I came back and the lecture was something about erythropoietin. And so here we are, it's this lecture about EPO, and you could tell that the professor really wanted to make it engaging. So they'd come up with something that, they thought like, oh, everyone knows about this, and oh, it was all over the news because there was all this stuff about EPO and doping at the time with the Tour de France. And so they spent all this time talking about something that was intersection between medicine and what we were doing in class and sort of pop culture. But all I could think of during this lecture was, oh my God, what is EPO? What is this? What am I doing? Why am I even here? I remember thinking I made a mistake because initially I had only planned on taking a year off, and I ended up extending it for a variety of reasons while I was in South Korea to stay a second year. And so I thought, oh my God, I should have stayed a third year. Like, I don't even know if I should even be here in medical school right now. And it just felt so awful. Not only had I been a chemistry major and I taught English to middle school and high school students for 2 years before that, in addition to that, there were so many other students that just were so confident and so brilliant. I remember there were a number of students who had already taken most of the classes that we were going to take for the first 3, 6, or even 9 months of the year. It was extremely humbling because literally the last major class that I had taken in science was something like physical chemistry. It was just so unapplicable to everything that we were learning. And it was made so obvious during this first lecture that I was extremely humbled because suddenly it felt like I didn't know anything about anything. And I realized, oh my gosh, I need to get my game together. So what I did is, through this very humbling experience, I had to spend a lot of time really trying to figure out what techniques would actually work. Not just for me, but that had been proven to work in multiple other cases for many other different kinds of students. What techniques had the highest evidence base? And so I spoke with lots and lots of people, and I was just very humble. And I said, okay, tell me what is it that you did that worked? Or what is it that you did that didn't work? And through this systematic approach, something incredible happened. I went from being just another face in the crowd who was struggling and wondering if I even belonged to consistently scoring in the top 5 to 10% of all of my classmates at Stanford. I then went on to score in the top 0.1% on the USMLE Step 1, which was way above where it is that I'd even intended to score. And eventually I matched in my dream residency at Harvard MGH. I think the moment where I really feel like I realized that things had turned around was that the person that I had thought of as the smartest kid in our entire class came up to me as we were starting our studying for Step 1 and asked me if I wanted to study together. And I was like, oh my God, if I could look at myself now in the beginning of medical school, I would not have believed it. So what I want to tell you now is the 8 techniques that created this transformation for me, and especially the ones that made the biggest difference. Technique number 1 is to get into the test writer's brain. The biggest game changer for me was learning to think like NBME question writers. One of the biggest mistakes I made early was that I was just trying to study the content itself. I'm not a huge fan of saying like you should study for the test. That's not really the goal, I think, here. What you want to understand though is that the NBME writes all of the most important tests, whether it's Step 1, your shelf exams, Step 2, or Step 3. And in addition to that, I actually think that the way that they write the tests is much better than any test that you'll take in medical school and aligns with generally good learning habits. So med school tests are largely about memorization. And if you think about the incentives of most professors, right, they're not paid to teach, they're not trained to teach. If anything, their promotions are not at all tied to their teaching and are instead tied to their clinical practice, and they're tied to their research. And so as a consequence, their exams that you take are largely written by people who are not trained and have very little interest in trying to write good test questions. And so the easiest way to write test questions is to just scrape things from their PowerPoint presentations and just see, did you recall that fact? NBME tests, in contrast, right? Step 1, step 2, step 3, shelf exams, they're all applied. They're asking, can you use the information, not just can you memorize it and regurgitate it? And so one of the most important things that I did was I turned away from just trying to study or pass my med school exams. And instead I said, okay, I need to be able to use this, not just because I want to do well and pass my USMLEs and other NBME style exams, but I also want to be able to use it so I can help my patients. In order to do so, I needed to understand the patterns and the rules of how it is that they construct questions. For example, they love asking about pathophysiology connections, not just isolated facts. They actually there's this 100-page document where they talk about the ways that they write questions and the rules that they use. And one of the rules is that they use clinical scenarios, not just as a way to see, can you reason through things, but also as a way to weed out people who are just memorizing the information. This single shift changed everything for me. And suddenly practice questions made a ton more sense. Technique number 2 is using application over memorization. So if we begin with the end in mind, we need to remember that, again, school tests are rewarding memorization and NBME tests are rewarding understanding. As a consequence, I needed to make sure that I was making connections, not just remembering facts. So for example, one of the things that I used to memorize was that ACE inhibitors would give you a dry cough. But once I understood why, it allowed me to go much, much deeper and learn other things more quickly, remember it better, and get higher scores. So ACE inhibitors cause a dry cough because they're increasing bradykinin levels, right? So it inhibits your ability to break down bradykinin. So bradykinin, which is a pro-inflammatory molecule, will cause inflammation. One of the things that inflammation does is that it increases the sensitivity that we have for pretty much all afferent signaling. So for example, if I have inflammation in my bladder, then normally, right, if my bladder is going to distend, I'm going to feel the urge to pee. However, if I have inflammation, now instead of it being, say, 300 cc's of urine before my bladder feels really full, now it might just be 50 cc's. And so it explains, understanding this concept allows me to see, okay, well, inflammation causes an increase in sensitivity. That increase in sensitivity is now going to make it, I can understand why I get urinary urgency and frequency. And because I also understand that there's an increase in pain that happens, right, the dolor of inflammation, I also understand why I would get dysuria in, say, cystitis. And so in the same way, right, bradykinin, if it's causing an inflammation in my airways, now I'm like, oh, okay, well, it would make sense that I would have a dry cough, right? Because now normally when I get something that touches my airway wall, I'm going to cough, right? Because there's this general mechanism in the body where it's like, if there's something that's there that shouldn't be there, right? If I've got a ton of stuff in my stomach and it distends, I'm gonna vomit. In the same way, if I've got even just a little bit of stuff in my airways, I'm going to cough. I'm gonna try to get it out. And so if I have an increase in bradykinin, the bradykinin causes inflammation, it would make total sense that an ACE inhibitor would cause a dry cough. And so what I needed to do is I needed to figure out how to connect disparate topics. I needed to be able to go from physiology, pathology, to pharmacology. And what I've learned in both my own experience, as well as observing top students and residents and physicians at all levels, and in helping coach students, some of them who have gone from literally failing these exams to being in the top 10 or 5 or even 3%. This is what separates top performers from just average or below or even slightly above average students. One of the most important realizations that I had was, if I can't explain something, why something happens, I don't really know it. In addition to that, when I understood the mechanism, I could reason through variations that I'd never seen before. So remember, the goal isn't to know more facts, it's to understand how these facts relate to each other. Technique number 3 is to use principle-based learning. Like I said, if I could understand why something made sense, everything else fell into place. This was especially true when I realized that medicine was really made up of a number of core underlying principles. If you think back to physics that you took maybe in high school, maybe in college, the vast majority of your introductory physics class, like the first year of physics, the majority of your first year of physics class is really just the first law of thermodynamics, right? It's conservation of energy. And if you think about it that way, right, there's so many problems that are really just the application of a single principle. When you think of a ball that's rolling down an incline and how fast is the ball moving, right? Really, that's just potential energy to kinetic energy. And a ball moving on a spring is really just the same thing, kinetic energy coming from potential energy. And there's just so many examples of this. And so one of the advantages that I had was that I had a chemistry background. I didn't know anything about anything in terms of actual biology or medicine or things like that. I didn't allow the way that medicine was taught, where it was just a bunch of memorization and just a bunch of like random facts that were thrown up on a PowerPoint. I didn't allow that to move me from my belief that there were still a handful of concepts that that could explain the vast majority of what it is that we were learning in medicine, even if they weren't explaining it. So I'll give you an example. So in chemistry, we learned that likes dissolve like, right? If something is polar, it will tend to dissolve things or dissolve in things that are polar. And if something's nonpolar, it'll dissolve things that are nonpolar. One of the many applications of this in medicine is that if a drug can cross the blood-brain barrier, meaning if it is a neurologic drug or if it's a psychological, like a psychiatric drug, it means that it must be able to cross the blood-brain barrier, right? Like if I've got an SSRI and it works on the serotonin reuptake inhibitors in my brain, then it must also cross the blood-brain barrier, right? Because it has to get there in order to have its effect. So if it can cross the blood-brain barrier, it must also be able to cross other lipid membranes, right? Since being able to diffuse across one lipid membrane is basically like every other lipid membrane, at least chemically speaking. And so if it can diffuse across one, it must be able to diffuse across another. So for example, there are some really interesting applications of this. Marijuana, right? We know that marijuana works on the brain. It also must be able to cross the skin. So I remember learning this principle and thinking, oh, well, I wonder if things like alcohol, which obviously affects the brain, they actually do, you actually can get alcohol. You can measure the amount of alcohol that is in your bloodstream, right? Because again, your skin is just, obviously you've got some protein and things on top of it, but it really at core, at base is just a lipid membrane. And so you can end up with so many interesting things, right? Like if I wanted to know if a drug can cross the placenta, right? If I'm counseling a pregnant woman and she's asking, oh, will this drug, could it potentially affect my baby? Instead of having to memorize these long lists of drugs, if I know that the drug works on the brain, or if I can give it orally, or if it's ever given transdermally, I also know that there's a very, very high likelihood that it is going to also be able to cross the placenta and potentially affect the baby. If you understand the why, and particularly if you understand the fundamental concept, now, instead of having to memorize thousands and thousands and thousands of facts, now I just learn one principle and I can apply it and I can basically predict how medicine or the body is going to act in many, many different scenarios. We were talking earlier about inflammation, right? So inflammation increases basically your sensitivity to things. And so again, it would make total sense that inflammation, say in my stomach, would also make me nauseous, right? Because now instead of my stomach needing a ton of food or a ton of distension in order to trigger that nausea reflex, which again, that's one of the major ways that we feel nauseous, right, is distension. If I've got inflammation in my stomach, then the amount of distension necessary to get me to the point of feeling nauseous or vomiting now is much less, right? All of these things make total sense. And instead of having to memorize, oh, well, gastritis can give you nausea, right? Now I know for a fact what things could give me nausea. So it makes retention that much easier because now I'm connecting it to something that I already understand. And instead of memorizing 100 or 1,000 facts, I can use a handful of principles, not only help me use it, but also help me learn new things that much faster. Technique number 4 is to develop good relationships with professors. As we talked about earlier, professors aren't necessarily taught to be great teachers. In my first 2 years of medical school at Stanford, I went to all but 2 lectures throughout my entire 2 years. There was one lecture, I think there were 2 lectures that I missed. One was because I was a TA for biochemistry and I had to miss it. And I think the other one, I might have been a TA, but I can pretty sure that I only missed 2 lectures the entire time. Even at that time, there were tons and tons of people. I'd say the vast majority of people were watching the lectures on 2x speed back in their pajamas in their apartment. Despite that fact, I would go to every lecture. And part of the reason why I did this was because I wanted to have access to the professor. And so as we discussed before, the incentives are misaligned for professors. They're rewarded basically not to teach well, right? If my promotion, if my salary is based off of my patient care and my research, then I'm basically being penalized the less I'm doing those 2 things. And teaching is really, again, the more that you spend trying to become a good teacher, the less time you're going to be able to spend on those things. So I don't blame them at all for the sort of system making them not as good of a teacher as they could be. That said, they also have incredible depth of knowledge in their specific fields. And so I would try to take advantage of that knowledge because I wanted to learn how to get to that level. I wanted to learn all of the secrets and all of the things that they had accumulated over their, in many cases, decades-long careers. And so, for example, I went up to a microbiology professor once and he'd said something that was interesting, kind of offhanded about, oh yeah, DNA viruses, yeah, typically cause cancer. And I was like, wait, what? Why does that make sense? He said, well, if you think about it, a DNA virus, in order to reproduce, right, they are by definition basically parasites, meaning they need a host in order to reproduce. And so they're not using their own protein synthesis mechanisms. They're not using their own, DNA or RNA nucleotides, right? They're getting everything basically from the host. And so if you think about it, there's RNA that's constantly being made, most cells, right? Outside of like red blood cells or things like that. In the vast majority of cells, they are constantly making and breaking down RNA because in order to make a protein, right, you've got the central dogma of microbiology. You go from DNA to RNA and then RNA to protein, but I need to have that RNA. An RNA virus, if it's going to reproduce itself, just needs free RNA nucleotides floating around, which in the vast majority of cells they're going to have because they're constantly making RNA. DNA is locked up. If you're not dividing, if you're not in the S phase of the cell cycle, right? The DNA is locked up in chromosome. And so there is no way for a DNA virus to have free-floating DNA nucleotides that it can then use to replicate its genome. And so what that means is that DNA viruses are the vast majority of viruses that cause cancer. Why? Because they will knock down P53, they will knock down RB, right? They will prevent the cell cycle checkpoints. They're highly incentivized to have mechanisms to cause cells to reproduce. So if you think about, say, EBV, right, which is a herpes family virus, which is a DNA virus, if you think about why our tonsils get so big, it's because they infect B cells and then they cause those B cells to replicate. And because they're knocking down the checkpoint inhibitors, right, P53RB in many cases, then it's much easier for them, not just because they are replicating more, right? So there's going to be more accumulation of errors in the genome. But in addition to that, they're also going to have less or fewer checkpoints to actually check and make sure that those defects in the genome are not passed on to progeny. And so, if you think about Hep B, here's the example of Hep B. There's a couple exceptions to this. One is Hep C, right? So Hep C is an RNA virus, but it causes cirrhosis many, many, many more times than it causes cancer. And the cancer really just comes as a consequence of having just so much cirrhosis and damage and chronic inflammation in the liver. Whereas Hep B is a DNA virus, right? Hepatin is a DNA virus. And so it causes cirrhosis at a rate that's many, many times lower than Hep C, but it causes cancer at a rate that's much, much higher. So it's almost as if Hep C is sort of accidentally causing cancer, and Hep B is causing cancer almost as a byproduct of the way that it replicates. These insights don't come from textbooks. Like I had so many insights that did not come from textbooks. Instead, they came from expert conversation, in talking with people who truly, truly are experts and that have been able to make connections and see things that I had no chance of being able to see. Technique number 5 is spaced repetition mastery. I spend about 20 to 30 minutes every single day in order to remember pretty much everything important that I learned since 2009. And not only did I learn it, but I'm still able to use it, has made a massive difference at every stage of my career. Most students learn something once and hope that they remember it for their test. And that was exactly how it is that I was. When I first started at Stanford, I remember that I was pretty good at learning things. Like I spent a lot of time talking to professors. After that initial shock, I really leaned into trying to understand things deeply. However, I was shocked at how quickly I would forget information. Because unlike sort of earlier science classes, there was just so much more information, and the information oftentimes did not come back until months and months and months later. And so what I would do is that every single day I would try to make good Anki cards and I would review them religiously. If you want me to make a video on this, please let me know in the comment. The general idea of what I was doing is that I wasn't just memorizing a bunch of facts. I wasn't just trying to learn how to regurgitate information, which a lot of what I did in the beginning was I would just memorize sort of all of the lines of PowerPoints, and I could do really well on tests. It was just a jumbled mess of facts in my mind. And whenever I would try practice questions in UWorld or say an NBME, I would just fall on my face. Instead of trying to memorize a bunch of facts, actually try to use the spaced repetition where you're making sense of things and you're putting those facts into a logical framework that then you can use as cards in Anki, and then do those Anki cards every day. And remember that the earlier that you start, the more powerful this becomes, because it is a hugely unfair advantage. I remember once I was being pimped by one of the Harvard MGH surgery residents. He was a PGY2 and I was a PGY1 at the time. And we had this, I was on the surgery service, and he was basically pimping the entire surgery service. It was probably 4 or 5 interns at the time. We were rotating with Tufts medical students because I was at Newton Wellesley Hospital. He was asking us about the mechanisms of diuretic. And these third-year medical students could not remember it, even though they had just taken step 1 a few months. And none of the co-interns, but because I had made cards during my first year of medical school, and I continued to do those cards, I knew not only all of the things that he was quizzing us on, but also things that he wasn't. Like I remember, he asked us about thiazide diuretics, and I named off a lot of just like random ones, like chlorthalidone. And you could tell that he was really, really, really taken aback. Obviously, the advantages move well beyond just being able to answer questions on pimping. It is a massive advantage. I didn't study for the vast majority of my exams after step 1. I was able to honor all of my third-year rotations basically off of the strength of just the fact that I remembered everything from my first 2 years of medical school. And I didn't study at all for step 3. Like there were so many things that I didn't have to do because because I just never forgot what it is that I learned. Technique number 6 is finding like-minded study partners. If you're someone like me and you believe that understanding why things work and how to make connections, then it becomes really, really valuable to try to find like-minded individuals. So one of my best friends at Stanford wanted to go into neurosurgery, and not just neurosurgery, he wanted to go to one of the top programs in the world. I knew that he was very similar to me. He was also a chemistry major in undergrad. And so we would basically go on runs together and we would just quiz each other in a good natured way and say, hey, do you know this mechanism? Or, hey, do you understand how this thing works? And if the other person didn't know, we would explain it. And then we would just ask each other. And so we would learn from each other and through teaching each other. It wasn't really just a study partner. It was also finding someone who is equally motivated and serious about really, really understanding things at a deep level. It's not surprising that he also did extremely well on the USMLEs, and he ended up matching at Johns Hopkins for neurosurgery, which was his top choice. He's now a spine surgeon making just obscene amounts of money in California. As an aside, you want to find those people who are serious in the same way that you are and really try to and so you want to find those people that can really, they say iron sharpens iron, and you really, really want to find people who are going to push you, right? I learned so much from him just in the way that he approached learning, the way that he approached just being disciplined about things and taking advantage of downtime. There's just so many things, and he's still a friend to this day. Every time I go to California, I reach out to him and, we go out for brunch. Technique number 7 is having external accountability and structure. As I mentioned earlier, I went to every single lecture in medical school -2, not necessarily because they were fantastic lectures that were completely well laid out, but because it gave me structure. I did not know this at the time, but I had ADHD. Looking back, it actually makes a lot of sense because I craved having external accountability systems. So for example, I would go to bed early and I would wake up early, and then I made it my goal to study at least a few hours before I would go to lecture, which started at 9. The fact that I had something that I had to do before I would go to lecture, and I didn't want to get there late to lecture, and so it gave me that external accountability to get things done. The few times that I tried to just study on my own without that external accountability, I would always find ways to procrastinate or do something else. Or in addition to that, I made it a commitment to make sure that I would make quality Anki cards every single day on whatever it was that they were teaching us in class. And so, for example, I would use first aid and I would say, okay, well, I need to learn all of the first aid material, whether they talked about it in class or not, that's relevant to this topic. So for example, if they were teaching us about coronary artery disease, I would find the page or pages in first aid about coronary artery disease, and I made sure that before the end of the day arrived, that I had made cards on all of that material. And in addition to that, I also made sure that I would make cards on the other 2 lectures, because typically we had 3 lectures a day, at least in terms of the sort of classroom type material. And so I would do my cards every day. I would do all of my old Anki reviews so that I didn't forget all of the information that I'd learned previously. And in addition to that, I would make sure that I learned whatever material that was relevant to what it is that we covered in class that day. And what this did, having the structure allowed me to solve the problem both of breadth and depth, because I'm the kind of person where I want to go really deep into it. I would go down rabbit holes and say, oh, well, that's interesting. I want to know why that is. Oh, that's interesting. But the fact that I told myself, okay, I need to get all of this work done. I would try to get as many of my old cards done before I went to my first lecture of the day at 9 o'clock. And then before I went to bed, I said, okay, I need to learn all of this material for these 3 lectures and make cards on all of the relevant first aid material. Because of that, it forced me to make decisions about, okay, well, I probably don't have enough time to go too much in depth in this because I've still got 2 more lectures and I've only got a few hours left. Structure creates consistency, and consistency creates results. And so I would use deadlines and systems to force daily progress. Technique number 8 was optimal time management. I'm naturally a night person, but as I mentioned before, I forced myself to go to bed early and wake up early. And so the key insight is that no matter what, I studied better before I had a long day, right? So normally, if just left to my own devices, I oftentimes feel more creative, I get a little bit more energy sort of at the end of the day. However, what I realized is that in medical school, particularly when I got to clerkships, even if naturally in a normal sort of day, I had sort of an increase in energy towards the end of the day, like if I was in class all day or if I was in the hospital all day, I would be tired when I would get home. And so even though I was a night person, trying to study at night after a really long day in the hospital or in class did not lead me to be at my peak mental state. And so instead, I learned that I would be at a more peak mental state if I would do my work before. And so the key takeaway is that you want to utilize the best times of the day for things that require more mental energy. I learned this technique from a friend who naturally was also very much a night person. And he said that his most productive time in medical school, even though he was also a night person, was when he would go to bed early and he would wake up early and he would use those early morning hours to tackle the hardest concepts. So those are the 8 techniques that transformed everything for me. And here's what I want you to understand. You're not bad at medicine. Instead, you just need the right techniques and system. These techniques work for pretty much anyone willing to implement them systematically. It's not about being naturally brilliant or having some sort of special talent. It's really just about having the right approach. In my coaching with students, this is exactly what it is that I see. We've literally had students. I had a student not too long ago who he failed step 1, and then in 2 months of he was using the exact same material, but in 2 months he went from failing, which is, they set the threshold at, the bottom 3%. So he was in the bottom 3%. He went from that to, in 2 months, using the same things, but using them differently, using the right approach. He scored a 92% on his NBME. On the old scoring system, before step 1 went pass fail, that would have been in the top 3%. Now that's probably like the top 0.1%. I mean, that's insanely high, all by just changing his approach. Next up, we have our Q&A section. This is where my team has compiled questions that are commonly asked and or asked in some of the comments, and I'm going to just go through them. So the first question is, how exactly did you set up your Anki system? What settings did you use, and how did you make cards that actually work? So that's a fantastic question. It's funny. I feel like Anki is such a poorly utilized tool. So many people end up using pre-made cards, in part because no one ever teaches you how to do it. It's kind of like if someone gave you all the tools to be a master surgeon, but they didn't teach you how to use them, the results would be disastrous. But in reality, if someone actually taught you how to do it, you could easily learn how to do it. And so what I did was I made sure that I set my new cards to 50 every day. So I never did more than 50, because in general, if you are learning more than 50 new cards a day, you will very quickly overwhelm yourself. And so for those of you that are using, the pre-made Anki decks where you're doing like thousands and thousands of Anki cards a day, generally I find that that's not a very efficient use of time. In part because if you're trying to memorize everything as if it's a fact in medicine, it's going to take you forever. It's just a really slow way of going about it. Instead, you want to set your goal at 50 new cards a day, do all old reviews, anything that's due that day, you should, that you've studied previously, you should do. And then make sure that the cards that you're making are of high quality. If you want me to make a video on this, please be sure to leave a comment so that we know what kind of video you'd like. The second question is, can you give more specific examples of NBME question pattern? How do you actually think like a test writer when studying? Also a fantastic question. We have a video on this actually. So if you search for NBME test writers guide, Alec Palmerton, MD, something like that, you should be able to find it. The short answer is that they are basically asking, can you use the information? There's this section of the rulebook, this like 100-page document where they tell you how it is that they write questions, where they list out like 7 or 8 rules. And 2 or 3 of them are basically some form of don't memorize stuff. We're just asking you to apply information. And that's pretty much, I'd say that's like the 20% that explains 80% of what it is that they're doing. Other sorts of rules in terms of patterns are that they have a cover the responses rule, meaning that you should be able to cover the answer choices, and a room full of experts, without knowing what the answer choices are, should be able to independently come to the same answer. You should be able to cover the answer choices and guess what the answer is going to be without getting distracted by what the other answer choices are. Because oftentimes what I see when I coach students is that they will get distracted by the distractor answers. Right? And so one way around that is just, again, understand how is it that they wrote the questions. They wrote it where you don't actually need the answer choices in order to answer the question. Now, the next question is, beyond likes, dissolve likes, what are the other key principles that unlock multiple topics? How do you identify these principles? Oh man, that's such a great question. So first, be sure to like and subscribe and hit the notification bell, because we have more and more content around these principles, and I will try to highlight them in as many videos, either content-based videos that we have on the channel, but also videos just like this. I would say my personal observation is that there's probably 3 key principles that will explain maybe 80% of medicine. So the first is ischemia, is demand greater than supply. The second is delta P equals flow times resistance, right? So pressure differentials, right? So for example, if you have mitral stenosis, right, that's resistance. Delta P equals flow times resistance. So anytime you have a lot of resistance, the upstream pressure is going to be higher, right? Sort of like if you have a hose and you kink the hose, like the hose that water your plants with. If you kink that hose, then the upstream pressure is going to be high and the downstream pressure is going to be low. And And so that's just one very sort of concrete example, but there's tons and tons of examples where, you can see that. Same thing with, ischemia is demand greater than supply. There's tons and tons of examples of this. Then the third one is acute versus chronic inflammation. And so if you understand those three principles, I'll give you an example. When you intubate someone, so my training is in anesthesia. And so when you intubate someone, there is the tube that you put down someone's trachea most cases has a balloon in it. And that balloon you inflate basically so that mucus and other stuff don't sort of go from your mouth into your lungs. And in addition to that, it kind of helps it stay secure. The problem though is that has pressure and it's putting pressure on the walls. And so again, if you think about it as a delta P equals flow times resistance scenario, if the downstream pressure is high, then there's going to be less flow. If the delta P is smaller, then the flow is going to be less. So the blood flow to that area is going to be less, just like you'd have in pressure ulcers. Okay, so if that happens, then that causes ischemia, right? Because now the demand of blood in the trachea tissue is going to be higher than what is being supplied. And over time, that ischemia is going to lead into necrosis, right? So that's our second principle. And then our third principle is going to be that eventually you are going to, if you get necrosis, you're going to have to clean it up. And so you're going to have inflammation that's going to come. You can have inflammatory cells, and that can lead, one of the key sort of things that can happen as a sequela of chronic inflammation is fibrosis. And so this is why when you intubate someone for 2 weeks or 3 weeks, you can get tracheal stenosis, right? Because you are causing ischemia, right? Because you keep putting pressure on the walls of the trachea. That pressure is going to decrease the flow of blood, which eventually is going to lead to ischemia. That ischemia is eventually going to lead to necrosis. And if it happens for long enough, it will lead to chronic inflammation, which will then lead to fibrosis, which is causing that sort of stricturing, that narrowing. So again, those three principles can be used to explain so many things, from MI to understanding, peripheral vascular disease to even just things like asthma. And so again, be sure to like and subscribe, because these are things that these take time. And again, it's one of the reasons why it makes a lot of sense to try to talk to people that are ahead of you, like your professors, getting in a coaching program, but something where they really are thinking about this from a principle-based standpoint. Next question is, what time did you actually go to bed and wake up? How did you maintain the schedule during clinical rotations and exam periods? Honestly, the key is that you want to go to bed at the exact same time and wake up at the exact same time every day. Typically for me, it was about 9:30, and that I would go to bed and I would wake up at about 5 or 5:30 a.m. And I did this throughout rotations. I would try to do my studying before rotations, and certainly in residency as well. I remember I lived on the Orange Line in the Boston area. I would always get the first train, and we lived on the first stop of the Orange Line. And so I just maintained this basically throughout my entire medical career. If you also like understanding things and want to learn faster and remember it better to get higher scores, be sure to check out our 14-day mini course in the description, where we share 14 of our best lectures from our larger course just completely for free. So be sure to check that out. If you found this helpful, be sure to check out my next video, how to make the greatest academic comeback. If you're struggling, or if you find yourself not reaching your potential, this video can completely change things and help you to set a much, much better trajectory for your career.